Heading into 2026, what is the biggest trend you've seen in patient goals for breast augmentation?
One of the biggest shifts with heading into 2026 with breast augmentation is smaller size implants and more of a focus on or interest in hybrid breast augmentation, so use of natural fat or fillers in addition to an implant. But I think smaller size implants with less change in the anatomy or stretching out are a little more popular. Patients are going for a little more subtle result. I think it's just changes in culture, kind of trends, but a more modest size implant. And interesting as a plastic surgeon, has less effect on stretching the tissue out, and it has a more natural look with a smaller size implant.
What is the recovery like with hybrid breast augmentation?
Hybrid breast augmentation utilizes either fat for fat grafting to add to the upper part of the breast and kind of fill in some of the cleavage, or an off-the-shelf fat product like Alaclay in order to give you a smoother, nicer result in terms of filling in tissue that may not be addressed just with adding an implant. It can add more time to the recovery in terms of the recovery from the liposuction itself, but generally this is really just, it's not necessarily additive in terms of the timeline, but just adds it, particularly a donor site. Say if fat's taken from the abdomen, it takes a little longer for that part to heal and just kind of adds, but it's a slight amount more discomfort. Generally, you're going to see bruising and some swelling from the liposuction site for really the first couple weeks, but after that, there's some degree of swelling for about the first 6 weeks.
Are people still asking for maximum volume, or is there a move toward anatomy-first aesthetics?
So there's definitely been more of a shift towards more natural, subtle looks in breast augmentation, and definitely see that. There's ballerina breast. I mean, you see different terms sort of talked about in the press, but generally a more natural result, kind of respecting natural anatomy, less overly augmented look. And I think that's just a trend, and it's just kind of what's popular now. But as a surgeon, I think it does respect the anatomy a little bit more, less likely to stretch out the tissue and have a kind of a more of an overly dramatic look. I don't see quite as many patients looking for massive size. I try to augment breast within kind of what's more of a natural look and what the natural shape of the breast can hold. And patients I'm finding are more accepting of that when I recommend a more modest or smaller size implant.
How do you choose the right breast implant size and volume by patient's body size?
There's a number of different factors which go into choosing the right size and shape of the implant. Definitely patient input first, kind of what they're looking for in terms of size and how much they want to change. Position of where I put the implant, kind of asking, whether it's in front of the muscle, behind the muscle, or partially. Patient input, but also my advice to them, kind of what they're looking for, and kind of putting those two things together. I think you have to look at the shape of the breast and the width of the breast. I mean, there's anatomy and size of the existing breast, and then you look at, choosing an implant, which, in my opinion, has to respect that. And when you overly augment it or put an implant, which kind of goes outside of the natural boundaries of the breast, that can cause more visibility or rippling and just has a tendency to potentially look a little more unnatural.
We're hearing a lot about hybrid breast augmentation. Can you explain how combining implants with a patient's own fat creates a more natural result?
Well, for patients who potentially don't have a lot of natural cleavage or that want a little bit more natural fullness in the cleavage area, doing a hybrid breast augmentation can add some fat naturally to an area where an implant's not going to give volume. So for patients who want the breast augmentation but potentially have a real thin upper chest wall, adding fat or fat graft material to that area is going to fill it in, give it a fuller, I think, more youthful look, just depending on the patient's existing anatomy. So it's a nice way to kind of harmonize the chest, because sometimes implants can look, it can have a tendency to look a little unnatural if they're very large, or for patients who are very thin. So it can add some of that fat and kind of smooth out those edges and might make the implant a little less visible.
Can a breast augmentation fix sagging, or is a breast lift needed too?
In and of themselves, breast implants really don't give a lift. I mean, we talk about this, that an implant gives potentially a little more fullness or a little bit of a rise to the nipple complex. But for the most part, for patients with just after kids, time, gravity, if that nipple position is low, a lift is going to be needed in addition to an implant. We call that a mastopexy augmentation. It's kind of combining both the the lift, and some additional volume.
For someone concerned about safety, what are the newest advancements in implant technology, like the Blue Seal indicator or lightweight implants?
Well, I think that breast implants have a great track record. I think if you look at silicone breast implants in terms of what we learned after the FDA moratorium is that they don't cause rheumatologic problems or connective tissue disorders. There was a lot of thought that they may cause that. Now, there is some controversy around whether or not there can be illness associated with it. Um, I think that breast implants have a very safe track record and they last longer than they did. We're looking at the sixth generation of breast implants now. And so there are some increase in or some improvements with the technology that implants are lasting longer. They do need to be replaced at some point. I think with any technology, any implant of any kind, they have to be replaced. But I'm seeing implants that are in for 20, 30 years. In general, I always tell patients, best case, maybe 10, 15 years. But in practice, I'm seeing them last longer. And I think we're only going to continue to see improvements with the safety profile and the longevity of those implants.
How soon can a patient return to high-impact exercise or an athletic lifestyle after surgery?
For my patients, I like them to refrain from doing very strenuous, heavy-duty working out, CrossFit, other activities, sports, skiing, for 6 weeks after augmentation. They can get back to light activities soon, but I like them to be minimizing that really strenuous activity to minimize any malposition or movement of the implants or the potential for any other problems that might occur from starting strenuous activity too early.
Can you define gummy bear implants?
Gummy bear implants refer to cohesive or a gel, and it has to do with just the type of gel and how that gel is chemically linked together. So it has a little firmer consistency. In the old days, the implants would be filled with medical grade liquid silicone that literally, if you pop the implant, it would leak out. Now, these more advanced, next generation implants that are more cohesive, it has to do with just how the silicone is processed and made in the lab. And they, I think, can have a firmer texture. They can be, less potential for leakage or movement outside of the implant if there is a leak. So it just has to do with the feel of the implant and the type of gel material that's inside.
How long does breast augmentation surgery take?
Breast augmentation surgery can take anywhere from an hour and a half to 3 hours, depending on if it's a secondary surgery, it's a primary surgery. It really just depends. The average primary breast augmentation is going to be about 2 hours.
Is implant replacement always needed? If so, after how many years?
An implant replacement is going to be needed at some point in the patient's life. I think that's fair to say. Implants won't last forever. That timeline is variable. For silicone implants, we start checking the implant's integrity about 5, 6 years afterwards, according to the FDA recommendations. And then if there is some leak or there's some problem with the integrity of the shell, it's recommended they be exchanged. As I said, about 10 to 15 years is what I typically tell patients is when they'd probably need to be looking at thinking about exchanging them. If there were any issues with implant position, other scar tissue that can develop, sometimes implants have to be changed out sooner. It really just depends on each patient's individual time course.